Good morning, everybody. I am Dr. Prithiviraj, Department of Biochemistry, Sri Lakshmi Narayana Institute of Medical Science. Today we are going to discuss about ketogenesis. So today we are going to discuss about ketogenesis. So you will be able to know about at the end of the lecture what is ketone bodies, what are all the ketone bodies, about ketone bodies, ketogenesis and its regulations, ketogenesis and the pathophysiological states, enumerate the abnormalities and the consequence of ketogenesis. So it's the most important because the ketone bodies are mainly acetone, acetoacetate, and beta hydroxybutyrate. So the primary one is acetoacetate, then acetone and the beta hydroxybutyrates are the secondary ketone bodies. They are formed from the primary one, acetoacetate. That is primary one. The acetoacetate is the primary ketone body. Acetone and beta hydroxybutyrate are the secondary ketone bodies. These are all the structures of acetone, acetoacetate, and beta hydroxybutyrate. So, what is ketogenesis? It occurs exclusively in liver mitochondria, only in liver mitochondria. Why? Because the enzyme HMG-CoA, hydroxymethyl glutarate, coenzyme A lyase is present only in the liver because this ketogenesis occurs in the mitochondria. In multiple choice question, they will ask why ketogenesis occurs in mitochondria. You have to tick because the presence of hydroxymethyl glutarate coenzyme A lyase is present in the mitochondria. This is the multiple choice question. It increased in diabetes mellitus and starvation. It increased in diabetes mellitus and starvation. What is starvation? Starvation due to many conditions. Due to fasting, for religious purpose, they are in fasting. So that time will get starvation. Due to chronic metabolic disease, poverty, and major disease, major surgeries. In this condition, starvation. In starvation condition, ketogenesis will occur in liver. Then increased uncontrolled diabetes mellitus. What is diabetes mellitus? It's the most important in biochemistry. You all have to know about diabetes mellitus. Diabetes mellitus mainly because of increased blood sugar level. Increased blood sugar level, that is hyperglycemia. Hyperglycemia means blood glucose level increased in blood level. So that is level is called hyperglycemia. Normally more than 138 milligram per deciliter in postprandial blood sugar. That is more than 140 milligram per deciliter blood sugar, the hyperglycemia. Mainly in diabetes mellitus. What are the signs and symptoms of diabetes mellitus? Polyphagia, polyuria, polydipsia. Polyphagia means they feel to eat more, feel to eat more. Polyuria means frequency of urine. So increased, so frequently they want to pass urine. That is polyuria. Polydipsia, feel thirsty. They want to drink more water. They feel thirsty. So that is this polyuria, polyphagia, and polydipsia. These three signs and symptoms of diabetes mellitus. So hyperglycemia and starvation condition, it will increase ketogenesis. And then heart muscles and renal cortex prefer ketone bodies as a source of energy. Heart muscles, renal cortex prefer ketone bodies as source of energy. Skeletal muscles and brain use ketone bodies when glucose is not available. See, skeletal muscles and brain use ketone bodies. See, liver only, exclusively liver mitochondria only produce ketone bodies, but liver is not utilized. Understand? Liver is not utilized ketone bodies, only production from mitochondria. But skeletal muscles and brain use ketone bodies when glucose is not available. So glucose is not available means hypoglycemia state. The brain and skeletal muscles will utilize the ketone bodies. Understand? Ketogenesis steps, how it's happening, that you have to know. Ketogenesis. So how it starts, acetyl-CoA add with one more acetyl-CoA, it will form acetyl coenzyme A. Acetyl-CoA add with, join with one more acetyl-CoA in the presence of enzyme thiolase, form aceto-acetyl-CoA. From aceto-acetyl-CoA, we will get HMG-CoA. HMG coenzyme A in the presence of HMG coenzyme A synthase. From aceto-acetyl-CoA, we will get HMG coenzyme A in the presence of HMG co A enzyme synthase, we will get HMG CoA. From HMG CoA, we will get acetoacetate plus acetyl CoA. From HMG CoA, in the presence of HMG CoA lyase enzyme, in the presence of HMG coenzyme A lyase, we will get acetoacetate. This acetoacetate and acetyl-CoA you will get. This acetyl-CoA will go and join with one more acetyl-CoA. It form then primary acetoacetate. The acetoacetate is the primary primary ketone bodies. So acetoacetate then spontaneously formed acetone. The acetoacetate is formed spontaneously formed acetone. Then another way, acetoacetate will formed 3-hydroxybutyrate. This is the another ketone body. It forms 3-hydroxybutyrate. In the presence of 3-hydroxybutyrate dehydrogenase enzyme, present in the presence of 3-hydroxybutyrate dehydrogenase. In this, we can get only energy, that is NADH to NAD. We are using one energy here. So from acetyl-CoA along with one more acetyl-CoA, presence of thiolase enzyme, you will get acetyl-CoA. From acetyl-CoA, from the enzyme HMG-CoA synthase, we will get HMG-CoA. From HMG-CoA, in the presence of HMG-CoA lyase enzyme, we will get acetoacetate. That is the primary ketone body plus one acetyl-CoA. Then from the acetoacetate, it will spontaneously acetone is formed. That's why it's a secondary ketone bodies. Then acetoacetate further it produce 3-hydroxybutyrate in the presence of 3-hydroxybutyrate dehydrogenase. Here we are using NADH, one energy, get NAD. Understand? Then regulation of ketogenesis. In 3 level, we are ketogenesis happening in 3 levels. That is the regulation of ketogenesis. One is lipolysis. That we can see one by one. What is lipolysis? Then entry into the mitochondria. So how ketone bodies entry into the mitochondria. Then oxidation of acetyl-CoA. Oxidation of acetyl, 3 steps. So commonly, free fatty acid are the precursor of the ketone bodies. So from what is the precursor of ketone body? Free fatty acid is the precursor of ketone bodies. Liver extracts 30% of free fatty acid in both fed and fasting. Now you understand what is the fed state, what is the fasting state. So fed and fasting state, liver extract 30% of free fatty acid. Understand? So factors regulating the mobilization of free fatty acid from adipose tissue. Adipose tissue means fat tissue. That is adipose tissue. Below the skin, subcutaneous, we are having adipose tissue, are important in controlling ketogenesis. So factors regulating the mobilization of free fatty acid from adipose tissues are important in controlling ketogenesis. So this is 3 level. We can see one by one. Okay. So the triacylglycerol in adipose tissue, triacylglycerol in lipolysis will get free fatty acids. In free fatty acids enter into the blood. From the blood, it enters to the liver. In liver, in acetyl-CoA, it enters into the one gateway that is called carnitine palmitoyl transferase 1 gateway. It enters into the beta oxidation. In beta oxidation, get acetyl-CoA. In the acetyl-CoA, it goes to the ketogenesis and they will get ketone bodies. So in acetyl-CoA, enter through the gateway. That gateway is carnitine palmitoyl transferase 1 gateway, enters into the mitochondria, then enters to the beta oxidation, then acetyl-CoA formed. The acetyl-CoA get ketone bodies in ketogenesis. Another way, enters the citric acid cycle. The acetyl-CoA enters through the other way is citric acid cycle. One way will get ketone bodies. This is number 1, lipolysis. Then entry into mitochondria. So from the blood, free fatty acid enter into the mitochondria by acyl-CoA. From acyl-CoA, it enters to the carnitine palmitoyl transferase 1 enters into the mitochondria through the mitochondrial membrane. Then acetyl-CoA in the beta oxidation get acetyl-CoA. From acetyl-CoA, one it will goes to the citric acid cycle, another one goes to ketogenesis, will get ketone bodies. The same time in blood, glucose is increased, glucose is present in the blood, then we'll get acetyl-CoA. From acetyl-CoA, we'll get malonyl-CoA. The presence of lipogenesis, in lipogenesis, we'll get malonyl-CoA. The presence of acetyl-CoA carboxylase enzyme. Acetyl-CoA carboxylase enzyme, the presence of acetyl-CoA carboxylase enzyme in lipogenesis, acetyl-CoA converted to malonyl-CoA. The malonyl-CoA is the inhibitor of carnitine palmitoyl transferase 1. Malonyl-CoA is the inhibitor of carnitine palmitoyl transferase 1. So now you understand, if you are having malonyl-CoA, it will inhibit the action of the gate. It will close the gate, inhibit the carnitine palmitoyl transferase. So the acetyl-CoA cannot enter into the mitochondria. So it won't get in fed state. Glucose is there, we'll get acetyl-CoA, then we'll get malonyl-CoA. Then malonyl-CoA is there, it inhibits the action of carnitine palmitoyl transferase 1. Now you understand? The same time, free fatty acid converts to acetyl-CoA. In another way, it's esterification to the acylglycerol. Then the acylglycerol back to the blood circulation, one very low density lipoprotein, VLDL. So very low density lipoprotein goes to the blood. Understand? So this is three cycles going on. From free fatty acid converts to acetyl-CoA. From the carnitine palmitoyl transferase gate, it entered to the mitochondria. Another side, from the glucose, look at acetyl-CoA in lipogenesis in the presence of acetyl-CoA carboxylase enzyme. So malonyl-CoA formed, the malonyl-CoA inhibits the carnitine palmitoyl transferase 1 gate. Same time, acetyl-CoA in the esterification, acylglycerols formed, then it produces VLDL in the blood. This is the entry into the mitochondria. Then entry into the same thing. Carnitine palmitoyl transferase 1 regulate the entry of fatty acid into the mitochondria. Carnitine palmitoyl transferase 1, it regulates the entry of fatty acid into mitochondria. Carnitine palmitoyl transferase 1 activity is low in fed state. Fed state means in normal glucose present in the blood. So while in normal state, it will be low in fed state, high in starvation. So starvation means hypoglycemia status. The activity of CPT will be high. So the fed state, CPT activity will be less. CPT is the one of the gate to only enter into the mitochondria. Understand? Malonyl-CoA is an inhibitor of CPT1. Malonyl-CoA is the, it inhibits the CPT. Understand? Here you can see the malonyl-CoA will inhibit the carnitine palmitoyl transferase. Also, in fed state, glucose available, malonyl-CoA will be formed. Same time, free fatty acid, in the starvation condition, it will enter to the mitochondria through carnitine palmitoyl transferase 1 gateway. Understand? Inhibition of TCA cycle. The oxaloacetate is used for gluconeogenesis. What is gluconeogenesis? Formation of new glucose from non-carbohydrate. gluconeogenesis. Glucose production, new glucose production from the non-carbohydrate part. That is called gluconeogenesis. Oxaloacetate is used for gluconeogenesis. Then acetyl-CoA is channeled to ketogenesis. This acetyl-CoA is channeled to ketogenesis to form the ketone bodies. Here, increased NADH and NAD inhibits the TCA cycle. NADH and NAD it increased and inhibits TA cycle. You understand? NADH and NAD increased. It inhibits TCA cycle. Then acetyl-CoA inhibits citrate synthase. Then acetyl-CoA increase, it inhibits citrate synthase. Understand? Then ketogenesis under pathophysiological state. Ketogenesis under pathophysiological states. So this is the 3 steps is seen. That is, one is lipolysis, entry into the mitochondria, oxidation of acetyl-CoA. The 3 steps, the regulation of there are regulation, how it's happen, how it's found free fatty acid, how free fatty acids enter the circulation. From the circulation, it enters into the mitochondria. The mitochondria, how it's enter through the ornithine palmityl transferase 1 gateway. So it inhibits by malonyl. It inhibits what? It inhibits malonyl-CoA. So malonyl-CoA, malonyl-CoA is an inhibitor of ornithine palmityl transferase. In CPT, one activity is low in fed state, high in starvation. Can you understand this? Ornithine palmityl transferase regulate the entry of fatty acid into the mitochondria. Once it will enter, then only it will form. Otherwise, it won't form ketone bodies. Understand? So ketogenesis under pathophysiological states. So the mechanism of diabetes mellitus. So diabetes mellitus means, so there is 2, you have to know that. One is insulin will be there, that is the insulin is resistant. So insulin will be available in the blood, but the organs are not utilized in the insulin. That is the insulin resistance. Insulin resistance. Another one, deficiency. The production of insulin is less. Production of insulin from pancreas, that is less. Deficiency of insulin or insulin resistance. So the diabetes mellitus means mainly hyperglycemia, more sugar, glucose in the blood in normal level. That is diabetes mellitus. That is called hyperglycemia. And insulin deficiency. This is 2. One is insulin resistance and insulin deficiency due to production of insulin from pancreas is less. In this insulin deficiency, acetyl-CoA carboxylase also decreased. So acetyl-CoA carboxylase enzyme, see here, acetyl carboxylase enzyme, see here, is less. So automatically malonyl-CoA also decreased. Understand? Malonyl-CoA marker unda. Acetyl malonyl-CoA also will be decreased. So relieves inhibition of CPT1. So it relieves means, so automatically all fatty acids and acetyl-CoA enters into the mitochondria. So if malonyl-CoA only inhibits the ornithine palmityl transferase 1 gate, are not allowed inside the mitochondria. If malonyl-CoA is less, automatically it release to enter the release the inhibition of CPT1, all free fatty acids enter inside. So acetyl-CoA converts to ketone body formation in diabetes mellitus. In diabetes mellitus. In diabetes mellitus, insulin deficiency. Here also two things you have to know. One is production of insulin is less, and another one is resistance of insulin. In these two conditions in diabetes mellitus, lipase it will be increased because of insulin deficiency. Lipase will increase. It will so if lipase will increase, so lipolysis will increase. So free fatty acid will increase. So once free fatty acid will increase, automatically it will enter to the ketone bodies. Production of ketone bodies will be more. What are all the ketone bodies? Acetone, acetoacetate, beta hydroxy, butyrate. These three are the ketone bodies that you have to know. So in insulin deficiency, automatically lipase will increase. So lipolysis will happen, more lipolysis. So free fatty acids, and from free fatty acid, we'll get more ketone bodies in diabetes mellitus. Okay. In the starvation conditions, hypoglycemia will be less. So hypoglycemia will produce gluconeogenesis. What is hypoglycemia? Less glucose in the blood. It is hypoglycemia. So glucose level in the blood is less. So the production of gluconeogenesis, glucose production from other than the carbohydrate, that is gluconeogenesis will increase. Automatically it depletes TCA cycle, intermediates, acetyl-CoA diverted to ketone bodies. If more acetyl-CoA diverted to production of ketone bodies synthesis. So less hypoglycemia, so less sugar in the blood, hypoglycemia, automatically other route, the glucagon will come, gluconeogenesis will increase, gluconeogenesis and deplete the TCA cycle intermediates, then acetyl-CoA diverted to ketone body synthesis. This is the condition of starvation. Starvation means many conditions. Okay. What are the conditions of starvation? Major surgery, major systematic disease, and shock, and major operations, fasting, religious fastings. This condition, starvation, poverty also, starvation will come. So at that time, blood sugar level will be less, hypoglycemia will happen. Once hypoglycemia will happen, automatically gluconeogenesis will start. Once glucogenesis will start, it depletes TCA cycle intermediates, and acetyl-CoA diverts to ketone body synthesis. Then ketone body will produce in the starvation. Fate of ketone bodies. What are the fate of ketone bodies? Normally, ketone bodies are less than 1 milligram, less than 1 milligram per deciliter in blood. Normally less than 1 milligram deciliter in blood. It excrete acetoacetate and beta hydroxy butyrate via urine, acetone via breathing. Acetone via the breath. That's why in ketone body, diabetic ketoacidosis, DKA. What is DKA? Diabetic ketoacidosis. In diabetic ketoacidosis, Kussmaul breathing, that is called Kussmaul breathing, excess of breathing, acetotic breathing, that is called acetotic breathing. The breathing smell will be acetotic breathing. Okay, it is called Kussmaul breathing, and that is in diabetic ketoacidosis. Ketone smell will be there. In the near patient, we will go to near the patient, the breathing smell will be in acetone smell. So that means the patient breathing, the acetone is evaporated, breathed out. So that is diabetic ketoacidosis. The smell itself, you can identify ketosis. Okay. What is, okay, I will tell later. So the excretion, how it is excreted, acetone, acetoacetate and beta hydroxypitrate via urine. Acetone only via breathing. Utilization of metabolic. The ketone bodies mainly utilizes as a metabolic fuel by neurons, the brain, neurons, skeletal muscles, heart muscles, and the kidney. The ketone body utilized metabolic fuel of brain, mainly neurons, skeletal muscle, heart tissue, and kidney. Okay. In well-fed state, how it will happen? How ketone body is not produced? So glucose will be increased. Also, insulin also will be increased. So the acetyl-CoA carboxylase will be increased. Once acetyl-CoA carboxylase will be increased, automatically malonyl-CoA also increased. Once malonyl-CoA increased, automatically the gate will be closed. What is the gate? It inhibits farnetyl transferase 1 gate. That will be inhibited by malonyl-CoA formation. So automatically the esterification is increased. This triacylglycerol synthase will be TAG synthesis is also increased. Here fatty acid oxidation will be decreased. Once fatty acid not formed, ketone body also less. Fatty acid oxidation is less, automatically ketone body also less, because the acetyl-CoA free fatty acid, it never enters into the mitochondria. Only in mitochondria there is one gate, CPT1. That gate will be closed because of acetyl-CoA carboxylase enzyme. It produces malonyl-CoA. Malonyl-CoA inhibit the CTP1 gate. Understand? In well-fed state, only we can't get more ketone bodies because ketone body will produce, but it will be less. Understand? Okay. In starvation condition, glucose will be less. So glucagon is the enzyme produced. So free fatty acid will be more. Then acetyl-CoA carboxylase will be reduced. So automatically malonyl-CoA is reduced. So it releases the inhibition of inhibition of farnetyl palmityl transferase. So automatically all free fatty acids and acetyl-CoA enter into the mitochondria. In this condition, esterification and triglyceride synthesis will be less. Automatically, free fatty acid will increase and the production of ketone body also increase in the starvation condition. This is opposite to the condition. Fed stage, it all will be opposite. Be increased. Glucose will increase, free fatty will decrease. There is no glucagon. Here, glucose level will be decreased, free fatty acid will be increased, glucagon will increase, automatically acetyl-CoA carboxylase enzyme will decrease, malonyl-CoA decrease, automatically release the CPT1, free fatty acid enter to the mitochondria, ketone body is production. Understand? Now, what are all the way we can find out mainly in urine? In urine, how we can find out the ketone bodies in urine? In urine, we can find out Prothros test. Prothros test we can do. Take 3 ml of urine. I will tell you the simple procedure. You have to know. The 3 ml of urine plus saturated with the ammonium sulfate powder, mix thoroughly and add 2 drops of freshly prepared 5% solution of sodium nitroprusside. 2 drops of freshly prepared 5% solution of sodium nitroprusside is added and mixed, and 2 ml strong ammonium added slow side of the test tube is left for 5 minutes. So add 2 ml of strong ammonium added slowly side of the test tube and keep for 5 minutes. Then you will get purple color ring is seen at the junction of 2 layers. So the presence of ketone bodies. So the purple of ring will formed in the between the 2 layers. You add in 2 ml of strong ammonia, then in between the 2 layer you will get good purple color ring formed in the Rothras test. So it means ketone bodies present in the given solution or in the urine. So the acetone and acetostate used for Rothras test. Specific test for acetoacetate is Gerhan's ferrichloride test. Gerhan's ferrichloride test. This is the specific test for acetoacetate. Gerhan's ferrichloride test. And in beta hydroxybutyrate, that is for modified Rothras test. Now you understand, in Rothras test, you can see acetone and acetate. For specific acetoacetate, Gerhan's ferrichloride test. In modified Rothras test for beta hydroxybutyrate. Normally in blood, less than 1 milligram per deciliter in blood. Understand? So now we can go for, we have to know what is those things. Acetoacetate is the primary ketone body. Acetoacetate is the primary ketone body because first acetoacetate only it formed. From the acetoacetate we will get acetone and beta hydroxybutyrate. They are all the secondary ketone bodies because from the acetate these two is formed simultaneously. So that's why called a secondary ketone bodies. Ketosis is seen in diabetes mellitus and starvation. So when ketosis is formed, is mainly seen in diabetes mellitus because in diabetes mellitus hyperglycemia and insulin will be less. In starvation, same. There is no, in starvation, hypoglycemia. So gluconeogenesis will start. Understand? Here, hyperglycemia, insulin will be less. So ketosis is seen in diabetes mellitus and starvation. It won't happen in the red state. Then Rothras test, I told, is commonly used to detect the presence of ketone bodies in the urine. In abnormal constituents of urine, you will check ketone body by Rothras test. How you will check the urine? In abnormal urine, what are all the present? How can you test the ketone body present in the urine? So Rothras test can check. So you will find out Rothras test is positive means ketone bodies present in the urine. Then acetyl-CoA formed from fatty acid is further oxidized in TCA cycle to generate energy. When availability of oxaloacetate is sufficient. So acetyl-CoA formed from fatty acid is further oxidized into TCA cycle to generate energy. Understand? Then availability of oxaloacetate is sufficient. Under condition of fasting and starvation, The oxaloacetate is channeled to gluconeogenesis, starvation and fasting condition. Its oxaloacetate is channeled to gluconeogenesis. Gluconeogenesis means glucose production from non-carbohydrate. So excess acetyl-CoA is then used for ketogenesis by because excess acetyl-CoA. Two acetyl-CoA to join and then form ketogenesis in liver by liver. Okay. The similar situation is seen in uncontrolled diabetes mellitus where gluconeogenesis and lipolysis are both enhanced. Same time, gluconeogenesis and lipolysis, free fatty acid will be produced. The excess of acetyl-CoA is converted to ketone bodies in hepatic mitochondria. The excess of acetyl-CoA is converted to ketone bodies in hepatic mitochondria. In HMG-CoA, form is cleaved by liver enzyme. The HMG-CoA is the cleaved, is a lyase. Lyase also, there is a cleaved enzyme. HMG-CoA lyase is the enzyme. The cleavage by liver enzyme lyase to the primary ketone body acetone. Acetoacetate may be reduced to beta hydroxybutyrate or spontaneously decarboxylated to the acetone. So acetone is the primary, may be reduced to beta hydroxybutyrate or spontaneously decarboxylated to acetone. Spontaneously it will form from the primary acetoacetate. Ketone bodies are synthesized by liver and metabolized by extrahepatic tissues, mainly cardiac muscle and skeletal muscle. So ketone body utilized by other organs, not by liver. But ketone bodies produced in liver. Understand? I already told. Under conditions of starvation, brain starts metabolizing ketone bodies for energy need. So the glucose is not available. Immediately, brain start metabolizing ketone body for the energy. If low glucose, automatically the brain will start metabolizing ketone bodies for the energy need. Since ketone body are acids, metabolic acidosis occurs. Excessive accumulation of ketone bodies can be dangerous since it can result in acidosis, dehydration, coma, death. For simple example, small example, in COVID patients, in ICU patients, in post-operative patients, in uncontrolled diabetes, diabetic ketoacidosis, DKA, diabetic ketoacidosis, what will happen? Small breathing. So you will enter near the patient, the smell will be in acetone smell will be there. So we can understand that is the patient will go diabetic ketoacidosis. So acetone, acetoacetate, beta hydroxy, ketone, all the ketone bodies are present. So in many conditions, so we have to maintain the and control the diabetes, control the metabolism. Otherwise, the ketone body will increase. Patient will go for acidosis and severe dehydration, and finally coma, finally death. In COVID also, diabetic is the one of the comorbidities. Many comorbidities support to the COVID. So who are all risky patient in COVID cases, mainly one of the diabetes mellitus and diabetes ketoacidosis is the comorbidities. So we cannot uncontrolled diabetes mellitus. So it increases ketone body. So we're not able to control, can't treat. Finally, patient go to the coma, dehydration, coma, death. Thank you, students. Thank you very much.